So today we are going to be discussing about reproductive health chapter. So we are going to be discussing about the chapter reproductive health. Reproductive health. Make sure you copy the notes, write by yourself and learn the notes by yourself, because that is what is very important. I will be explaining you the concepts very quickly, but ultimately you have to study the notes, because that is very important. Now, according to WHO, first we have to talk about what is health. So according to WHO, reproductive health means, reproductive health is nothing but total well-being. A person should be totally fit, total well-being. So a person should be totally well-being in all aspects, basically. In all the aspects, a person has to be well of reproduction. All aspects of reproduction, he should be well. All aspects means what? All aspects include physical, emotional. Emotionally also he must be fit, and social and behavioral. So in terms of all aspect a person is fit, then he is told to be fit. India was the first country. India was first country to initiate action plan for planning program. FPP means family planning program. One of the first countries, okay, amongst the first countries. So family planning program in 1951. In 1951 only India launched this family planning program. India launched this family planning program 1951. Now you should know what are the tasks. Now there is reproductive and child health care, RCH program. Reproductive and child health care, that is a full form of RCH, okay, reproductive and child health care program. So their main goals, what all they focus on: they provide information to adolescents, info to adolescent about hygienic practices, STI, sexually transmitted infections. About all these they provide information. They provide information about breastfeeding. They give info about breastfeeding. They create awareness about pregnant mother, postnatal care. Postnatal care, after birth, what care is required. Postnatal care of mother and child, basically. Benefits of massive child immunization, they give that is vaccines and all. Children should be given vaccines, right? Then role of NGOs, they explain. Sex related aspects, role of NGOs in that. Awareness spreading social evils such as sex abuse. About these they spread information. Crimes, and then educating people about birth control options. They educate people about that. Then benefit of families with small size. Introduce sex education in school. So all these was the reproductive and child health care program. the roles whatever they have been involved in. Now population stabilization. Next is population stabilization. So according to 2011 census, our population growth rate was less than 2%. That is 20 per thousand per year. That was less than 2% population growth rate. Reasons for increase in population size, but the population size has still increased. Why the population size is increasing? Reasons for increase in population are: one is decline in death rate, rapid decline in maternal mortality rate. Mortality means death, okay? So maternal means mother's death rate is low. Decrease in infant mortality rate, children mortality rate, death rate also is very low. Infant mortality rate, IMR. Increase in number of people of reproductive age, increase in number of people of reproducible age, increase in health facilities, increase in health facilities. So these are the reasons why population of the India is increasing. Now what are the measures taken by government to control population? Measures taken by government. What are the measures taken by government to control population? Motivate smaller families. They motivate smaller families. By using contraceptive methods. Hum do hamare do, you might have heard that. Advertising campaign and posters they did. Urban couples adopting one child norm. Marriage age is raised. Female 18 years, male 21 years is the marriage age. Incentives are given to couples with small families. Incentive means some benefits are given to them with small families if they have small family. So because of that, people will prefer smaller families. Now what are birth control and contraception? Birth control and contraception. So what are features of ideal contraceptive? Ideal features of ideal contraceptive are: it should be user friendly, it should be easy to use, it should be easily available, it should be effective, it must be reversible, it must no or least side effect, and no interference with libido. Libido means the interest to have sex. It shouldn't damage that pleasure, basically act of ketis. So people shouldn't lose pleasure because of using the contraceptive. It should still be pleasurable. There are two principal methods of birth control. Two birth control methods are basically there. Two methods are basically there. They are natural and artificial. Two types of methods are there. Now, natural methods, if you talk about, natural methods contain periodic abstinence, periodic abstinence. Then it also has withdrawal method, exactly before ejaculation. Withdrawal of the penis is called withdrawal method. And lactational amenorrhea, when mother is lactating, when she is producing milk, when she is feeding the child, when she is just got pregnant, that time menstrual cycle is not there up to 6 months. So at that time couple cannot get pregnant. So these are natural methods. Naturally, by these methods, like periodic abstinence means 10 to 17 days of menstrual cycle, fertile period. During that time, avoid avoid ketus at that time. So these are the three methods. Withdrawal method is withdrawal from the vagina prior to ejaculation, and lactational amenorrhea is 6 months. 6 months during breastfeeding. She is women is generally she cannot give birth. Artificial methods are barrier methods, which involve a barrier between the penis and the vagina so that the sperms cannot enter. Next is spermicidal, which kill the sperms. Those are called spermicidal methods. Next is IUDs, intrauterine devices, devices which are put inside the uterus. So those are known as intrauterine devices. Then you have oral pills. Pills are taken, and then injection and implants. Injections or implants. Some implants are put inside the body, and then last one is emergency contraceptive. That is also pill. And then there is also the surgical method. These are different artificial methods which require human intervention. Okay, so barrier method, examples of barrier methods are example of barrier method is condoms, diaphragms, cervical caps, diaphragms, cervical caps. These are rubber barriers which are cover the cervix. Then spermicidal jellies. So spermicidal are jellies here. Okay, these are different. IUDs are intrauterine devices. So there are different types. If you talk about intrauterine devices, there is copper T IUD, different. So there are non-medicated, medicated. IUDs are of two types: non-medicated and medicated, which have medication. Non-medicated example is Lippy's loop. And medicated are again two types: hormone releasing and copper T. Copper releasing, because copper ions can kill. So copper T is an example. Hormone releasing is progesterone, LNG20. All these are hormone releasing. Oral pills. Oral pills are given contraceptive oral pill, OCPs. They are known as OCPs, oral pills, oral contraceptive pills. So examples of this, Saheli is an example. It has progesterone along with estrogen, combination of that. Okay, so within 21 days starting, pills have to be taken daily for period of 21 days. So 21 days the pill has to be taken for first 5 days of menstrual cycle. preferably first 5 days of menstrual cycle. So there are steroidal and non-steroidal. Okay, so two types are there. Steroidal example I am given here. Saheli is a non-steroidal. This will interfere with implantation, and these are non-steroidal. These are steroidal. Progesterone, all the steroidal. This is example is progesterone. Progesterone. Saheli was developed in Lucknow, Uttar Pradesh by at CDRI. Implants are placed under the skin. They are also progesterone only. Progesterone and estrogens are released by them, or injections are given. So implants are put under the skin. Emergency contraceptives are also same, progesterone plus estrogen combination. They have progesterone plus estrogen, effective within 72 hours of ketus. You can take them after 72 hours until 72 hours of ketus in case of emergency. These are used in case of some unprotected intercourse, or when if rape happens to someone, she can use emergency contraceptive. And surgical sterilization method is poor reversibility but high effective. Those are surgical methods. We cannot reverse them. Surgical methods cannot be reversed because they require cutting. Tubectomy is you cut the fallopian tube of the women and stitch it. Tubectomy. And vasectomy is the male. In males, vas deferens is cut. That's why it is called vasectomy, vas deferens. And here tube is fallopian tube is cut. So these are the different methods. Now MTP act, medical termination of pregnancy, is called as MTP. MTP means medical termination of pregnancy, where pregnancy can be terminated. So abortion, basically, other name of abortion. Then amniocentesis. Analyzing the fetal cells and dissolved substances from amniotic fluid. This is used to check genetic disorders, Down syndrome, hemophilia, sickle cell anemia. If a child is suffering from any of these diseases before the child is born. So, female feticide. A ban was put on this technique because some people were using it to determine the gender, and then they were killing the female child. So, because of that, a ban was put. Next, you must know about what are STIs. STIs means sexually transmitted infections. Those can be bacterial, protozoan, or viral. Viral example is genital herpes, hepatitis B, genital warts, and AIDS. Acquired immunodeficiency syndrome, that is AIDS. Okay, full form. Protozoan diseases is trichomoniasis. There is nothing to explain here. You are supposed to remember these examples. Bacterial examples are gonorrhea. That's why I am doing it very fast. Syphilis, chlamydiasis. These are examples of different types of sexually transmitted diseases. Then there are some techniques which are used if couple are unable to produce child, then how they are assisted in case of infertility. If they are unable to have babies, that is called as infertility. So different techniques which are given are ART. ART means assisted reproductive technology. So two types of assisted reproductive technologies are there. One is in vitro, in test tube what is done, and other is in vivo, in the body of the women what is done. So example of in vitro are ZIFT and ICSI. These are example. Here example is gift and AI, artificial insemination. So ZIFT full form is zygote intrafallopian transfer. Basically you are going to produce the zygote in the test tube and then going to transfer it inside the fallopian tube of the female. So zygote intrafallopian transfer, you are transferring the zygote inside the fallopian tube of the female after fertilizing it in vitro in the test tube. Then you have the intracytoplasmic sperm injection. You are going to intracytoplasmic sperm injection. So it's a micro injection where the ova of the female donor or wife is taken out and sperm's nucleus is taken out via micro needle, and then it is made to fuse. The sperm and the ova are made to fuse inside the test tube outside. Okay, and gift, here gift in vivo, the process is gift, which is gamete intrafallopian transfer. Gametes are taken. Females who are not able to produce ova can produce suitable environment for fetus. So if they are not able to produce ova, ova from female donor is taken. Gift means ova. Ova is taken from, egg is taken from female donor. A donor will be present and it is made to fuse with the male sperm, and then it is put inside the wife, the female's body who wants to become pregnant, and then she can get pregnant. And then AI means artificial insemination. Artificially erectile dysfunction or somebody is having less sperm count, then or sperm can be collected from an donor, and then it is put inside the body of the female, and then she is made pregnant. Artificially she is made pregnant by artificially inseminating her. That is artificial insemination. Or last process, adoption. Adoption is legal in India. Orphan children can be